Guys, right to go? Very good, thanks for joining us. There are 1,749 new cases of coronavirus, all locally acquired. That means we now have 22,476 active cases across Victoria. I'm sad to have to update you that 11 Victorians have lost their lives with COVID-19. 2 women and 2 men in their 70s, 4 men in their 80s, 2 men in their 90s, and 1 woman in her 100s. This will be obviously a very difficult time for family and friends of those 11 people, and we send our best wishes and our deepest condolences to the family and friends of each of those people. There are 784 people who are currently in hospital with COVID-19. 149 of those are in intensive care and 100 are on a ventilator. Of the cases in hospital yesterday, 88% were not fully vaccinated, and of the cases in intensive care yesterday, 96% of those were not fully vaccinated. Now, they are statistics, but they really are stories of individuals who are very, very unwell, and one thing that they all have in common is that they've not been protected by 2 doses of any of the 3 vaccines that are available as never before to Victorians right across the state. Or to put it another way, if you don't want to finish up in hospital, then access one of those 3 vaccines. They will keep you safe, they will keep you well, they will keep you out of hospital, and they will help us all to reach our national plan targets and to be open, not just for this Thursday, but for us to meet our 80% target on or about that Melbourne Cup weekend, and indeed to go beyond that, to finish up with 90+% of the community vaccinated. That level of protection will make us one of the most vaccinated, one of the most protected jurisdictions anywhere in the world. To that end, there were some 36,751 vaccines administered in our state hubs yesterday, plus of course those administered by community pharmacy and those administered by GPs in GP clinics. That brings us to 89.4% of the population that is 16 and over have now had a first dose of one of the COVID-19 vaccines, and 67.2% have had both the first and the second dose. So we are well placed to reach our target of 70% double dose and to open up as of 11:59 p.m. Thursday evening, which is a great credit to the work of so many Victorians, now more than 5 million that have had at least 1 dose. And beyond that, we remain on target. That sort of 30th, 31st, around that time, just before Melbourne Cup, we are on track to be reaching that 80% double dose target and delivering all of the roadmap promises at that point. That too is well and truly ahead of schedule, because Victorians have in record numbers and in record time come forward to get their first and their second dose. I just want to commend though to everyone who has got a second dose appointment. If you can bring that forward, please do so. We've had a number of interval changes. There are a number of appointments that are outside that interval. If you can bring it forward, then that's terrific for you and for everybody. Beyond that though, this Thursday night will come and go. Melbourne Cup Day will come and go. 80% will come and go, but second doses will always be important for those who need them. Honouring those appointments right the way through is incredibly important, because it's only with 2 doses that you are fully safe against this virus. And the other issue, of course, is if you are on the fence, if you're thinking about whether you will or won't get vaccinated, then please go and book a first dose appointment. Don't become one of these people that are in hospital that, for whatever reason, were not part of the vaccination program. To that end, we do acknowledge and understand that our community is a particularly diverse place, and there are many groups for many different reasons that may not necessarily be vaccinated to the level that the broader community is. That's 70 and 80, and indeed, from a first dose point of view, very close to 9 out of 10 people over the age of 16. That's why today I'm announcing a $21 million package to do even more work. There's been a lot done to this point, but to do even more work to support those who may face additional barriers to being involved in that vaccination program, to get their first dose and their second dose, to be protected for themselves, but also to play their part in protecting all of us. Whether that be people living with a disability, youth that are at risk, seniors, culturally diverse and multi-faith different communities, social housing residents, and of course, these are only examples, and of course as well, victim survivors of family violence. That $21 million includes $13 million to support Victorians with complex needs. So, to give you another example, young people in the child protection system, social housing residents, those living in supported residential services. This funding will help to book appointments, promote existing transport options, or arrange alternatives where that's needed, or to offer respite or occasional childcare in suburbs with low vaccine uptake. As you've seen, we've taken this program right into local communities with pop-ups and micro pop-ups, literally neighbourhood vaccination activity, end of your street vaccination activity. That's one of the reasons why some local government areas of significant concern to us only a few weeks ago have gone from 50% single dose to over 90% single dose in just a matter of weeks. We've had a really focused, a really concerted effort, and it's just been wonderful in terms of the outcomes we've been able to achieve. But that last minute push, that push to get to those really high numbers, that has to involve going back and doing more in all of the targeted efforts that you've done to that point. That's where this package comes into its own. There are a number of other elements to this, and I think you've got a media release that takes you through all of those. But hopefully that's seen for what it is. It is that last minute push to add to all the considerable efforts we've already put in place to try and get these vaccination levels as high as we possibly can in every part of the state, in every different group, in every different way. I'm now going to ask Naomi to speak to the kind of chain of transmission issues and a bit of an epi picture, but also she's going to talk about pop-ups and some of the increased and additional vaccination access opportunities in lots of different parts of metropolitan Melbourne and indeed into regional Victoria. Deputy Secretary.
Thank you, Premier. 28% of new cases today were in the southeastern suburbs, including 153 in Casey, which was the highest number of any area, and 132 in Greater Dandenong. 28% of new cases were in the northern suburbs, including 145 in Hume and 135 in Whittlesea. 30% of new cases were in the western suburbs, including 127 in Brimbank, 122 in Wyndham, 111 in Melton, and 5% of new cases were in the eastern suburbs, including 21 in Manningham and 20 in Knox. In regional Victoria, we had 145 new cases, which is stable at about 8% of new cases, and that brings the regional Victoria to a total of 1,660 active cases. There were also a handful of cases with interstate addresses. In terms of those larger regional outbreaks, there were 24 new cases in Latrobe, 18 in Greater Geelong, 18 also in Bawbaw, and 13 new cases in Wodonga, which are mostly linked, either directly or indirectly, to the Z bar in Albury. This exposure site is being managed by New South Wales Health, and it has generated a number of cases in Albury as well as in Wodonga. Details of that exposure site are on the New South Wales website. Pleasingly, Mildura seems to be stabilising with only 6 new cases. Moving to vaccination, our pop-up program and our neighbourhood program are continuing at pace throughout this week. We're running 7 more of those mini pops at various cafes, sporting clubs and community centres this week. I do want to call out the Moroccan Soup Bar, which is running today with a focus on providing access for diverse women in that community. Also apparently chickpea bake for all who turn up for vaccination there. Some of our larger pop-up vaccination sites this week include the Craigieburn Sports Stadium on Craigieburn Road. That's running today and Wednesday. The Kingsbury Bowls Club on Dunn Street, which is open tomorrow on Thursday. Bowes Avenue Community Hall in Airport West, open tomorrow and Thursday. And the Fawkner Community Hall and Senior Citizens Centre is open until Thursday. Now that site did 160 doses yesterday, and 20 people that came forward yesterday were people living with a disability and neurodiversities, and they were able to access the tailored accessible room that's available at that site. This is a really great site for people who need accessible parking, people who might need dim lighting, wider booths, experienced staff and communication boards. And I guess picking up on the Premier's announcement, that's really one example that shows that if the right supports and facilities are in place, we really can continue to make sure that no one is left behind in the vaccination efforts as we move to open up the state. A bit of a reflection on some of the good news stories coming out of our pop-up and neighbourhood vaccination program over the previous week. So this past weekend we ran 16 school pop-ups in key local government areas all around the state. That was our biggest weekend yet for the school pop-ups, and we administered over 6,000 doses. We're going even bigger this weekend with 17 school pop-ups planned again all across the state. This weekend we also ran our Casey Fields site with 1,800 doses administered over 3 days of operation, and we had lots of reports of essential workers coming forward at that site and getting their first and their second doses, which is fantastic. There are literally tens of thousands of first and second dose appointments available at state sites all across the state at the moment, and there is plenty of walk-up capacity too. We are having more and more walk-up capacity at sites, so please do jump on the website and have a look if you haven't made an appointment. It's very likely that you'll be able to find a site where you can just walk up and get your vaccination dose. More than 27,000 people booked their vaccinations in state clinics yesterday, including almost 22 second dose appointments. And again, I would echo the Premier's comments that if your 3-week interval for Pfizer is up and your appointment is sometime in the future, it is a great time now to think about just coming forward, getting that appointment in, seeing if there's a walk-up place near you, going to a pop-up, get your second dose in as soon as possible as we race towards those all-important milestones of 70% and 80% in the not-too-distant future. I'll hand back to the Premier for questions.
Thanks very much. I don't have an exact number on available appointments, but there are, as Naomi just said, there are walk-up spots at multiple clinics, multiple state hubs right across the state. There are literally tens of thousands of spots available over the coming week in state clinics, in community pharmacy and in GP surgeries. It's never been easier in many ways to either complete your vaccination journey or indeed to begin it. Either way, you'll be protecting yourself and you'll be playing your part in us reaching these milestones, getting open and indeed staying safe. Happy to take any questions you have.
There are LGAs like Darebin that are still well below where the state is sitting. How are we targeting those?
So some time ago, Simon, you remember that we talked about 27 postcodes that were under the state average. That's where so much of the pop-up and kind of micro pop-up work, the neighbourhood end of your street sort of campaign has been targeted, and we're seeing some significant improvements there. But for whatever reason, there are a number of people who've chosen not to get the first and second dose. I would respectfully say to them they've made the wrong choice. They are far more likely to finish up in hospital than somebody who has gone and protected themselves by getting fully vaccinated. We'll continue to work with those communities. We'll continue to push and make the case and try and make it as convenient as possible, literally going door to door almost. But ultimately people have to make their own judgments beyond, of course, some of the workforce mandates that we've put in place, which are working well and will keep us all safe in those environments, whether it be hospo this week or retail in just a few weeks' time.
Have you been able to lift the other 27 postcodes?
Yeah, I think we've seen improvement because we're seeing improvement everywhere. Whether we've got them up to exactly where we want them to be, I'm not quite certain of that, and we'll probably round that out toward the end of this week. We'll have a clearer picture once we've reached that 70% double dose rate. But look, perhaps we can make that a feature of a briefing sometime next week, for instance, just to give you a bit of an update.
With hospitality, there seems to be a bit of confusion between some advice given by the Department of Justice and the Department of Health about the need to be double vaccinated for staff versus patrons. So I just wondered if we could get
staff need to be double dose vaccinated. Yes.
Vaccinated from the
yep,
opening.
from when they open, because the opening and the number of patrons that are allowed, the easing that we've done is predicated on people being double dose vaccinated, and I don't think that anyone would find fault with the logic that says if I've got to be double dosed to sit down and order a beer or a glass of wine, then the person who's serving me needs to be double dosed also. Now look, given the sort of numbers we're talking about, 90% single, we're racing towards 70% double, we're going to get well beyond that. I think that most people, knowing where this has been headed and warnings that were given many, many weeks ago, I think people will be well and truly covered. The other thing too is that we don't have a full staffing complement. We're very clear about that. With 50 outside and 20 inside, that's not full for the vast majority of places. So it's just very important that we try and be as consistent as possible. I apologise if there's been any confusion, but our position's been very clear.
Is that if you're single-dosed hospital worker, you can't work?
No, you need to be double dosed. That's the advice that I have. That's the answer to your question. And I think that when I've talked to lots of people in this industry in the last couple of weeks, lots of people, and they've all known and understood that the vaccinated economy is about keeping them open. It's about keeping them and their customers safe. And they've all been very clear that they need to get their staff through the first and second dose. That's the feedback that I've got.
On Sunday, you announced that pubs, clubs and entertainment venues can have limited capacity and open this weekend, but recently it was removed, entertainment was removed from the announcement. Can you
Yeah, I think it's
clarify?
important. Recently is an interesting term. I think within hours of a typo being up on a website somewhere, that was corrected. And again, I apologise if there's any sense of that a sector's been included that shouldn't have been. But it does not include entertainment venues. Entertainment venues will be covered by 80%. And again, I just stress, that's not this Thursday, not the Sunday straight thereafter, but the Sunday after that probably. It might even be the Saturday, so it's like 8-9 days later. And I know that's frustrating. Everyone would like to be open at the one time, but we're not talking about a 3-month gap between one milestone and the next. It's literally 8 or 9 days, and then we can have everything open. Yes, there'll still be rules, but because Victorians have done such an amazing job, we're gonna race and hit that second deadline, the 80% deadline, much quicker than we thought. That was going to be the middle of November. At one point, far from that, it's weeks and weeks ahead.
So just to be clear, your current projection is Derby Day essentially for the 80% double
Very
dose?
difficult to know whether it'll be the Saturday or the Sunday, Simon, but the advice I have is that it's likely to be sometime on that weekend.
Yep.
Which I'll perhaps know where you're headed. It does present us with a fantastic problem to have, and I think there's some work going on at the moment about whether Melbourne Cup Day is in fact the trial event or whether Derby Day might be. That's not settled. I'm not here to make announcements about that. It may be possible, it may not be, but we're certainly working with the VRC around that.
And if we reach 70% double dose earlier, well, the projections we had from the federal government this morning was that we could achieve it tomorrow. It'd be reported Thursday. Would you bring
Sure.
forward the reopening?
No, I think it's been we've made it very clear that Thursday, 11:59 p.m. Thursday night, everyone's working to that deadline. We announced that a couple of days ago. I think people are really pleased and positive and upbeat about that, and they're all working to that deadline.
I know there's been a lot of discussion about this already, but have you reconsidered allowing freedoms for both the vaccinated and non-vaccinated when we get to those vaccination milestones at some stage?
How do you mean? Sorry?
In a similar way to New South Wales, allowing freedoms for both the vaccinated and non-vaccinated at a stage when the state is at a level
Sure.
of coverage that's high. Have we reconsidered doing that at all?
I understand the question now. In terms of the vaccinated economy, to tell you the truth, I'm not 100% clear on what New South Wales' position is, and that might be my fault rather than theirs. I can recall Gladys making some announcements about maybe 5 or 6 weeks after the vaccinated economy started, you would fold it up and it wouldn't be there anymore. I don't know whether Dominic has done the same thing. I honestly don't know the answer to that. That doesn't make any sense to me in any event, and we won't be doing that here. Like, why would you just get the system going? Why would you have the thing up and running and then essentially pull all that down, pull all the architecture that you built, all the infrastructure that you built, the culture that you've changed? Why would you change that 4 or 5 weeks later? We will not be doing that here. I'm not going to say to someone, oh, look, just wait us out, will you? Just wait 4 or 5 weeks and then you'll be able to go to the pub. No. If you make the judgment to not get vaccinated and you reckon you can wait out us or the publican or whoever you want to think you're waiting out, you won't wait out the virus, because the virus will be here for a long time, and your only protection against it is being vaccinated. This will be well into 2022, well and truly into 2022. Then we're going to get into booster issues, so it won't be your first and second dose, it'll be have you had your third? And then the other issue will be, well, who knows what variant's coming? Who knows? Like, we don't. So we've got every reason to be confident, we've got every reason to be optimistic and upbeat. The Victorians have done an amazing job, but that job includes us making some difficult decisions, and that's to keep people who are not vaccinated out of some of those venues that we've been talking about today.
So how long do you foresee us
I can't put a date on it.
vaccination?
I cannot put a date on it, but I can tell you this: it will not be when we reach 90%. It will not be, you know, anytime soon. That's going to function for a period of time, well into 2022.
There's been reports that there's been thousands.
For instance, I'll give you an example. The Grand Prix is in April. I don't think there's going to be crowds at the Grand Prix made up of people who have not been double dosed. Just to give you a time frame. Doesn't mean it'll end the day after the Grand Prix, but that just gives you some sense. Please don't play that game of let's just wait them out and then we'll be able to do everything we want to do and have not got jabbed. No, that will not be the case here. And if you make that choice, it'll be a very long wait, and you won't outwait this virus. If you're not vaccinated, you'll get it, and you've got every chance of becoming very, very unwell.
Just on that, if Victoria takes that stance, it likely could be inconsistent with the other states with what New South Wales is planning. Are you concerned that Victoria may be viewed as in economic terms as a place that people couldn't do business with because
No, I wouldn't think so.
We'll be in that position when the other states aren't?
No, I wouldn't think so. Not when 90+% of the community by that stage, probably 92, 93, 94% of the community over the age of 12, which is pretty much, well, most of the consumers across our state will have been double dose vaccinated and will be in the process of getting their third shot. And again, the third shot's a matter for the Commonwealth. I don't know who's going to get that and when, but the clock's ticking. We're going to have to start doing booster shots, particularly for our older Victorians who were the very first people to get the first shot. We'll have to do that quite soon. So I don't see that as a competitive disadvantage at all. In fact, quite the opposite. That will mark us out as a safe place to come and visit, a safe place to be part of. That's what such high vaccination levels mean.
Are you frustrated that the federal government hasn't started the booster program for those that received the vaccine first?
No, I'm just. There are some things that I can stand here and talk to you for very long periods of time about in great detail, and there are some things that I can't. So the booster program is for the Commonwealth government. But look, what we want, it's not a sense of criticism. It's just what we would really appreciate. I think is some clarity as soon as we can, and I'm sure the Commonwealth's working towards that. Because if we can just sort of seamlessly move from 55 state hubs and a whole lot of pop-ups, if we can just switch that across to a booster program, rather than pull all that apart, close it all down, then have to start again, that assumes that the Commonwealth wants us to play that role. Only they can answer that. But we're certainly happy to do that work, because ultimately the consequences of that not being done well, that'll be something that's very real for all of us.
But many of those workers are like state nurses, doctors
Exactly.
in our health system
Exactly.
that may not be protected going into the next year. So isn't that more an issue that Victoria could get ahead of and try and say to the Commonwealth, we need to start these booster shots for these people because they're not protected?
No, we've certainly made that point.
Well.
We've certainly made that point. But there's no argument. I think it's more about how you do it, not whether we will. I think there will be a booster program. Orders have been placed. Stock is here. It's just a matter of the Commonwealth making clear what their plans are and whether their plans include us. There's also there's some pretty big threshold questions. Is everybody going to get a booster shot, or is it just targeted groups? That's a matter for all sorts of different people, but none of them work for the state government. They're all national. But we stand ready to play whatever part the Commonwealth thinks we should.
When do you think Victoria will open international borders, much like New South Wales is on November 1?
Well, Victoria won't open international borders. It's the Commonwealth who will open international borders, and I think the Prime Minister made his position pretty clear the other day. But I'm very keen that we have a National Cabinet meeting and that we get everybody on the same page, and that there's, as best we can, a consistent quarantine process, a consistent set of dates for when different groups of people, whether they're international students, business visas, returning Australians, whether they be permanent residents or Australian citizens, whatever other kind of green zone arrangements that the Commonwealth may well, like a New Zealand type arrangement, if they've got others of those that they want to put forward, all of that really does fall to the Commonwealth Government. There's some irony that this whole thing has come down to who's responsible for what, given that we have rather rewritten who's responsible for what over the last 20 months. But I don't issue visas or passports. That's a matter for the Commonwealth Government. But we want to have, and be in no doubt, we will have a quarantine system that is as light touch as possible. And when you get to 90 plus vaccination rates, we always have more options. And we've made that point hundreds and hundreds of times. That's why it's so pleasing. And it's why I think we're all so proud of each other that we've gone and got the jab in record time and in record numbers. It does give us more options. That means we might be able to do, in fact we almost certainly will be able to do some home-based quarantine for some people, no quarantine for others, if they're double dose vaccinated and they've got a negative test.
What about red zone arrivals from New South Wales tomorrow? I think the rules change tonight.
They do, as I understand it, yes.
What are you expecting in terms of numbers coming?
Well, I think there'll be significant numbers of people that, for the best of reasons, and I thank them for the sacrifice they've made. They were not coming to Melbourne, they were not coming to regional Victoria. Things have now changed. It's now safe for them to come home, and you know, as we've always said, we don't want people locked out of our state, and we don't want people locked in their homes. And the key to that was people getting the jab, and millions and millions of people have.
Will there be Victorians coming home, do you think, or tourists from New South Wales?
I think in the main there'll be people who at least spend, or whether they're Victorians or people who, the vast majority will be Victorians. There'll be some others who spend significant amount of time in Victoria every year, but I think there'll be people coming home in the main.
There's been reports that there's thousands of people wanting non-urgent elective surgeries that have been delayed because of COVID-19. Is that a concern for you? A lot of these.
Look, everyone wants their surgery as fast as they possibly can, no matter what category they're put into. Like if you need surgery, then you want that surgery fast. Of course you do. We provided literally hundreds of millions of dollars earlier this year to try and catch up on the backlog from last year. Then, of course, you know, we finish up with this Delta variant comes to Melbourne. Came once or twice. I think we defeated it. Then it came and we could not keep it under control. And months and months later, we've had to modify elements of elective surgery again. That wasn't a choice that's made lightly. It's not something we enjoy doing in any way. So just like last year, there was a big effort to catch up. Next year there'll be a big effort to catch up as well. I would just make the point that it's not politicians who determine whether you're Category 1, Category 2, Category 3. Clinical staff, doctors and nurses make those judgments. And if someone's clinical position changes and they move from being a Category 2 to becoming an urgent Category 1 patient, then they would get their surgery within the 30 days. We have made some adjustments in Melbourne and Geelong for Category 2 and Category 3. Not for Category 1, those most urgent patients are getting their surgery in the clinically recommended time, and we will get everybody else their surgery as fast as we possibly can. But you know, we're all members of families, we've all got friends, and I was talking to a friend the other day who's been on the list for a little while to get what might seem a relatively minor procedure, but it's causing them significant pain. And in talking to them about the changes we had to make, they weren't pleased. But then when we sat and thought about it for a moment, the number of people who are going to need a machine to breathe, the number of people who are going to need ICU and that really high and intense level of care, my friend and I think many others, they get it, that the sickest have got to be treated quickest. But we'll get to catch up, we'll get to deal with that backlog just as fast as we possibly can.
How long is your advice that that's going to take?
The backlog?
No, not the backlog, but the shutdown of Category 2 and 3 surgeries. Is that going to last well into next year?
Yeah, look, it's very difficult to say, and I wish I could say, right, it's next Friday or the Friday after or whatever it is. But we do have to a certain extent, we have to wait and see how many people present. And the good news and while we're able to do the things we announced on Sunday, some of those bring forwards and some of those extras that we're able to include with the 70% opening, is because of two things. One, Victorians have got vaccinated in unprecedented terms and with real speed. And secondly, the burnout modelling shows us, and the numbers show us, that there are less people in hospital. Now, is that trend going to continue, or will we confront something different, Rich? That's the thing we don't know. The way to answer your question is we will have those modifications those changes to elective surgery. We'll have those off and get back to normal as fast as we possibly can, and then there will be additional funding provided to do the normal blitz to try and catch up.
Just on the vaccinated economy trials,
Yep.
people in the events industry have contacted us saying they're really concerned that some small minor events haven't really had a look in for these trials in metropolitan Melbourne, particularly when as you talked about before, you're looking at Derby Day potentially as a trial day. What's your message to the events industry that have really not been able to operate at all this year?
Well, part of the challenge is that 70 and 80% are going to be reached pretty well within a week of each other. That is a fantastic problem to have. So the notion of having multiple weeks to run the kind of the partner to the regional trials that are operating now in Metro Melbourne, we're not going to have that time. That is a wholly good problem to have. What it means is, though, the places are going to be open and events will be being held, small, large and everything in between. There'll still be rules, there'll still be processes to be followed and all of that, because we are coming out of something that's been very, very significant, and we don't have unlimited hospital capacity, all of those things that I think are well and truly understood. But what's better than trial events, actual events, I would have thought. And we're learning things this very moment from those 14 or 15 regional trials that are going on, and we'll work very closely with all of those event organisers. We'll work very closely with businesses large and small. It is a fantastic thing to think that Victorians have got vaccinated so fast that the difference between 70 and 80 is pretty well 1 week. That is an amazing thing, and it's something that every Victorian should be very, very proud of.
Do you envisage a point where unvaccinated people in hospital receive less of a priority than people on those elective surgery wait lists?
No, we always provide care based on clinical need and your vaccination status. We provide care. Our dedicated staff provide care to people based on their clinical need. They make no further judgments about who you are and your views and the circumstances in which you became unwell. That's a pretty slippery slope. What I would say, though, is that why would anyone want to make the job of our nurses harder? And the fact of the matter is, if you are unvaccinated by choice, then you will make, one way or the other, either by getting ill and needing care, or through contributing to the spread of this virus, and others getting ill, you will make the job of our nurses harder. So for every good reason, to protect yourself, to protect the people you love, to take some pressure off our nurses, then for heaven's sake, it's free, it's safe, it works. And 5 million of your fellow Victorians have had at least one dose. So this is the program to be part of.
You said that international.
Parliament's sitting next week, and
Yes.
there's been a number of MPs that either won't get the vaccine or won't hand over their medical records.
Well then, as the Houses have determined, then there'll be limits on what role those people can play.
How does that, in your mind, who've been a politician for a long time, fit with the idea of democracy? These people have been put there by their local constituents. Usually there are different laws that operate in recognition of the fact that, parliamentary privilege and such that give different rules to these people.
Yeah, but all I'd say to you is this. No one has the right to contribute to other people getting sick. So if you forget to wear your mask, or you have a brain fade and take it off a couple of days in a row as you walk 20 metres to a press conference, then you pay the fine and you cop it and you just move on, right? That's the first point. No one has the right to contribute to the illness of someone else, or the unavailability of a bed for a non-COVID patient, because there's an avoidable COVID patient in the very bed that the heart attack, the stroke, the premature baby, the list goes on, needs. The other thing too is that I don't remember, I've got a pretty good recall of the 2018 election, I don't remember anybody running around saying, if there's a global pandemic, I shall not be vaccinated and I will make a stand on this. No one's been elected with that mandate. No one's been elected to make that point. And the other thing too is Parliament's not just a place where lots of speeches get made, where there's lots of carry on and laws get made as well, yes, of course, but it's also a workplace. It is a workplace, and there are hundreds and hundreds of people who work there who they have every right to expect that they'll be kept safe too. So and they have to be vaccinated, so why shouldn't the members?
Given that, do you think candidates ahead of the election next year, not just for Labor, but anybody that's running should be vaccinated?
I haven't given that any thought, actually. No, I haven't thought about that. I'm not sure what the conduct is.
They won't be allowed, is what you're
Well, I'm
saying?
not. No, hang on a minute. Hang on. Being a candidate, and there are literally thousands of those for public office, and having been elected, and then wanting to perform part of your role, which is to be inside in a workplace with lots of other people who are staff, they're two very different things. I would have thought, but I don't know whether there'll be impacts on the conduct of the election next year. There may be. I don't know. We'll just have to wait and see, and there'll be health advice provided to the Electoral Commission, I'm sure, about airflow and ventilation and filtration and all those sorts of things, probably. But let's hope we can have an election and lots of other events between now and then as close to normal as possible. That's why getting your second shot, bring it forward if you can. If 3 weeks has passed but you're still outside, your second dose is some weeks away, then please try and bring that forward. Please honour your appointment. And if you're sitting on the fence, undecided about whether to go and get the first dose, please go and get the first dose, and don't finish up in hospital.
Premier,
That's a pretty good deal, I reckon.
Premier, speaking of bringing it forward, is that something that could happen for Cup weekend for people wanting to go and visit the regions that entire Cup weekend rather than the Sunday, which I think is October 31st, the 80%? Is that something you're considering?
I think just before you joined us, Richard, we were talking about Derby Day potentially as the trial. We've got to work that through. I'm not announcing that, but again, terrific problems to have if you're well early when it comes to some of these milestones. I haven't necessarily given that any thought just yet, but again, lots of things become possible because Victorians have done an amazing thing and they've done it in record time. So, I don't see that as a negative. I think that's a real positive to have to perhaps revisit lots of different things because people have done exactly what we asked them to do in record numbers and in record time. And
also bring it forward, would you be happy to, bring forward the suspension of local voting rights in the ALP from 2023 to now, given the audit of the party membership has been done?
No, it's not actually a matter for me, but I'm...
Well, you asked for the intervention.
I did, yeah. But the method under which elections are held, or the reinstatement of a rank and file democratic process, I think there's a number of things that are occurring at the moment that we might benefit from waiting for them to run their course.
But do you think it's fair that rank and file members who pay their membership aren't allowed to participate in pre-selections for both the federal and state elections next year?
Again, I've made my position very clear on that. Clearly, I believe that is a necessary outcome, or I wouldn't have called for it.
What's your advice to business owners who say that they're nervous that they have to now get their staff to enforce vaccine passports when they open this weekend? How do you suggest that they handle a situation where someone's frustrated they won't be served?
Well, I would ask for people, customers as well as staff, everyone across the board, we all have to be patient, and in anticipation of that, I'm deeply grateful to people. I'm sure people will be as respectful as they can as staff. They'll be as patient as they can be, noting that it's not a normal opening, it's not a normal trip to the pub or a visit to a restaurant. It is different. We are still in the midst of a global pandemic, and there are rules about QR coding, about vaccination status, about how many people can be in a party, how many people can be inside and outside, and how far apart they should be, all of those things. So there's some structure, there's some rules. I just ask everyone to be as understanding and as accepting of the fact that it is special, it is different. It's not the same as informal as it might normally be. But I think people are well and truly used to some of those rules. I'd ask people to behave obviously appropriately, but above all have fun. And that's exactly what I think people will be doing come Friday.
IBAC has heard this morning that Daniel Mayor Rick Garotti successfully lobbied the state government for grants to go to community groups to reward factional work. How concerning is that to you, that factional work is being rewarded through community grants?
My concern, Rich, is to allow IBAC to do its work. And when that work is concluded, further to your earlier question, we've made some very significant changes to rules in our party, and if we have to go further, we will. But it's not my practice to be commenting on those matters, which, by your question, you make the point. I think this is very live. It's happening literally as we stand here.
More widespread than just...
As I said, my concern is to allow IBAC to do its job, And when it's finished its job, if we have to go further, if we have to do things differently, if we have to implement recommendations and findings, then of course we stand ready to do that 100%.
Should Rick remain Mayor of Banyule?
That's a matter for him. Again, this process has not yet concluded. It's only the beginning of the process. Let's allow it to run its course, and then we can be well informed by that afterwards.
Is it tenable for Nazir Al-Asmar to remain Legislative Council President after Rick Garotti revealed in IVAC that he was potentially involved in branch theft?
Well, again, I think the important thing here is to not be assuming that processes that are just starting are actually finished. I don't think they are. In fact, I know they're not. It's still an ongoing matter, and we should not be drawn into debates and discussions and drawing conclusions from those things. That's an ongoing process.
Do you have confidence in Nazir Al-Asmar?
Yes, I do.
Premier, projections show
And
that-
so does the Legislative Councillor. He wouldn't be the President.
Premier, projections show that we are on track to hit 90% double vax rate in November. At that point, do you still anticipate limits on home visits, venue density requirements, mask requirements, etc.?
I want to try and have the lowest, the smallest number of rules impacting on people's lives as we possibly can have as soon as possible. So whether that's at 90% or at some other point, 90% will be, well, every milestone's a proud day for Victorians. 90% will be a particularly significant one because it does takes us into that, very small group of countries around the world that'll be as protected as that. It will, to answer your question though, it will depend how many people are in hospital, how many people are really, really unwell, and what sort of pressure we have in our health system at that point. And we can't be certain of that. We've got modelling that's more optimistic, and we've got the current case numbers are lower than we thought they would be. But 90% is still a little way off, and we're just going to have to monitor that. And indeed, we'll have to monitor in the weeks after that. So there's some work that says the peak will come before Christmas. There's some work that says, yes, there'll be that peak, and then there'll be another peak, say 4 or 6 weeks later. So we just have to work all that through and be guided not just by assumptions, but by the actuals. But our aim is to have the least number of rules possible.
At what point do you think businesses can know what those rules will be? Obviously,
Sure.
for some, this week is a cause for celebration, but some events, industries, particularly the events industry, for example, live performance, they can't really hold viable events until there's a much larger number allowed.
I would simply say to each of those sectors, we'll give you as much clarity as we can, as fast as we possibly can, and we're all working as hard as we can to do that quickly. So, for instance, the live music sector, there's some further roundtables with Minister Pearson later on this week. I know Martin Bakula's in almost constant contact with that events sector and others. We have this really good problem to deal with, and that is that all of these milestones are not weeks and weeks apart. They're all happening in the space of a couple of weeks. So that's good. But we've brought forward a whole lot of work that we've had to do as well. Well, we were well and truly ready, but you do have to wait and see how things pan out a bit. But it's not for the lack of effort, and it's not for the lack of our absolute commitment to get everything open as fast as we can, as safely as possible. So as soon as we can give those industries clarity, we will.
Just on your Grand Prix comments,
Yes?
does this mean that unvaccinated tennis players like Djokovic won't be able to play in the Australian Open?
Well, again, I've sort of been asked this question before, and what I'd say is that I don't think an unvaccinated tennis player is going to get a visa to come into this country. And if they did get a visa, they'd probably have to quarantine for a couple of weeks. I don't know that will necessarily, when no other players had to. So I don't think that's going to be a relevant issue. So.
But in your opinion, should they be, if they are able?
My opinion on getting vaccinated, I hardly think I could have been clearer.
Well, should they be able to play if they're unvaccinated?
Professional sport is on that list.
Yeah, that's exactly right. So they will have to be vaccinated. What I'm saying to you is that it falls at the hurdle much earlier than that. So, for instance, AFL players have to be vaccinated, but they're Aussies, right? They're not coming from other countries by and large. I don't think that the person you indicated, or any other tennis player, let's not personalise it, any other tennis player or golfer or Formula One driver will even get a visa to get here. So it kind of becomes moot. But as Annika points out, professional sport is part of those authorised worker list, and they have to be double dose vaccinated.
So we have that stay in place throughout summer, I guess.
I'm not. I think I earlier indicated that this is here for a while, and we're not going to be essentially encouraging people to not get vaccinated because they reckon they can wait a few months or a few weeks. Oh well, you know, I can put up with not going to the pub. I'll just wait them all out. You can't wait out coronavirus. It's going to be here and circulating, as the Chief Health Officer said the other day. We're all going to get this at one point or another. The only question is, will we be protected by a vaccine, a world-leading vaccine, or will we be in a hospital bed gravely ill? I know which one I'd choose. And I have, because I'm double dose vaccinated, as are 9 out of 10 Victorians very, very soon.
Premier,
So
I know
whoever is associated with an event like the Australian Open need to be vaccinated for it to go
Yes,
ahead?
because they'll all be authorised workers. But on the international point is the point I'm making. I don't control who gets to come in, but it's my understanding is that it's highly unlikely that in just a few weeks' time, business visa holders, so workers for instance, or tourists who are not Australian citizens or Australian permanent residents will be given visas to come here unless and until they have got 2 doses. But again, there's been a few premiers in recent times kind of commenting as if they're the federal immigration minister. I don't want to do that. That's my understanding. If I'm wrong, I'm sure that the federal government will point that out to
So
you.
are you against any special deals being done for players coming in for a big, important, major event here in Melbourne? It makes us a lot of money.
On the issue of whether someone's vaccinated or
Yes.
not, no. The vaccine doesn't know. The vaccine doesn't care what your tennis ranking is or how many Grand Slams you've won. Sorry, the virus does not care. It's completely irrelevant. You need to be vaccinated to keep yourself safe and to keep others safe.
On Sunday, there were 3 asylum seekers in the Park Hotel that contracted COVID-19.
Yes.
Many will get results today. Many inside of the 40 plus people there say that they're feeling unwell. Are you concerned that these numbers could rise?
Yeah, I got a
inside
a pretty quick briefing on that this morning. I'll have some further discussions about that later today, but if we can provide you with any further clarity through the Chief Health Officer's release later today, we will.
A bit of a niche one, but was getting some air on radio this morning. Driving instructors, where do they sit on that vaccine mandate if they're using their own personal cars? Is that part of their home?
I wouldn't think so, but let me get some specific advice for you on your self-confessed niche question. I will chase that up. I will, rather than make it up, I'll chase it up.
Can I just, I know we covered it a bit before, but just
Yep.
to be crystal clear on the pubs, because
Yes.
the AHA apparently sent out an email, I've got it here, to their members this morning saying that the Department of Justice confirmed the fully vaccinated requirement only applies to patrons. So,
Well,
and you said before...
that's
it's
not the
only
advice that I have, and I will chase that up. And this is
Yeah.
why we make announcements that don't take effect for a few days, so that all of these sorts of issues can be ironed out, including niche issues and others that can't reasonably be foreseen. But the advice I have as I walked into the room today is that there's been weeks of notice. That's the advice I have, that you can't very well have someone unable to walk in and sit at the bar and drink a beer unless they're vaccinated, but the very person who's pouring you the beer has only had 1 shot. That doesn't work.
According to the authorised worker website, though, you have to have 1 shot by the 15th of
Yeah,
October,
yeah,
or have a booking
yeah,
by the 22nd, and then it's from the 26th of November, you'll also be required to provide evidence to your
Yep.
employer that you've received your 2nd dose.
Yeah, but
So are
Mark,
they locked out effectively now, or once they get to the 26th?
No, but hang on. That's for authorised workers, otherwise known as workers in venues that were open. Right? That does not apply to hospitality venues. That when that list was drawn up and when those rules were put in place, those venues were closed. Those venues are now open from midnight this coming Thursday. There's probably lots of different ways you can make the point, but they are now open. Of course, they can go to work, but they need to be, just like their customers, they need to be fully vaxxed. That's the advice that I have.
And authorised work from Friday, authorised workers don't require a permit. Is that right?
Correct. Yes, I think it'll only be for the purposes of travelling into regional Victoria. You can only do that for permitted reasons.
Yeah.
But let me get you the exact wording on what and what is not required. But I don't believe so, no. Because it'll be, everybody can go to work where their workplace is open. But at the same time, there is advice that says if you can work from home, we would ask you to continue doing that. That of course changes quite significantly once we get to 80, when pretty well everything opens up with limits. Those limits will then change over time, earlier to the question about 90 and indeed beyond. All good?
Just quickly, any idea when Mildura will come out of lockdown?
Not today, but as soon as we can have them on the same footing as the rest of regional Victoria, we will do that. The stability that's come to those cases in the last 24, 48 hours is good. So hopefully that decision is not too far away, but it's not one for me to make today, and there's been no decision to that effect made yet. Any other issues? If not, thank you all. Have a good day.
Thank you.